Understanding vaginal odor. When is it normal and when is it a concern? It is a common misconception that the vagina should be completely odorless. In reality, a natural, mild scent is healthy and expected. This scent is dynamic. It shifts based on your menstrual cycle, diet, sweat levels, sexual activity, and hormonal fluctuations. The key to maintaining vaginal health is not about eliminating scent, but about recognizing changes in your baseline. Understanding the difference between a natural shift and a medical issue is essential for effective self-care. The science of balance. pH and bacteria. The vagina is a self-regulating ecosystem. It relies on a delicate balance of bacteria to maintain an acidic environment, which acts as a natural defense mechanism against harmful pathogens. When this balance is disrupted, the scent changes. Common triggers for these shifts include biological factors, menstruation, sweat, and hormonal changes. External factors: semen, which has a different pH, certain soaps, and even tight, non-breathable clothing. Lifestyle factors: antibiotic use, which can inadvertently kill good bacteria, or douching, which strips the protective acidic layer. Identifying common causes. If an odor becomes persistent, strong, or unpleasant, it is often a signal that the internal ecosystem has been compromised. Bacterial vaginosis, BV. BV is one of the most frequent causes of a noticeable fishy odor. It is not an infection in the traditional sense, nor is it strictly an STI. Rather, it is an overgrowth of certain bacteria that disrupts the natural pH. It is often accompanied by thin, gray, or white discharge. Yeast infections. While yeast infections are more closely associated with intense itching and thick, cottage cheese-like discharge, they can also cause subtle changes in scent. These are common during pregnancy or after taking antibiotics. Sexually transmitted infections, STIs. Certain STIs, such as trichomoniasis, are known to cause strong, abnormal odors and unusual discharge. If an odor is accompanied by pelvic pain or occurs after a new sexual partner, medical testing is vital. Retained objects. A sudden, overwhelming, and foul odor can be a sign of a forgotten tampon. This is more common during light menstrual flow, when a person might not notice the object is still present. This requires prompt medical attention to prevent further complications. The impact of hormones and life stages. Hormones play a decisive role in vaginal health by dictating the levels of estrogen, which directly affects vaginal tissue and pH postpartum and AMP. Breastfeeding. Lower estrogen levels can alter the vaginal environment. Perimenopause and AMP. Menopause. As estrogen declines, the vagina may become drier and the pH may rise, making the area more susceptible to BV and irritation. The risks of self-treating. One of the most significant mistakes in vaginal health is attempting to fix an odor through aggressive hygiene or incorrect medication. Warning: using over-the-counter yeast treatments when you actually have BV or vice versa can exacerbate irritation and delay proper healing. Avoid the following fixes that often backfire: douching and scented washes. These strip away protective bacteria and can worsen an imbalance. Deodorant sprays and perfumed wipes. These introduce chemicals that disrupt the natural pH and cause irritation. When to consult a professional, you should move away from guesswork and contact an OB/GYN if you experience a persistent fishy or foul odor lasting more than 48 hours. Discharge that is gray, green, yellow, or unusually thin. Physical discomfort, such as itching, burning, swelling, or pelvic pain. Pain during intercourse or urination. Fever or general malaise accompanying the odor. A healthcare provider can perform a simple pelvic exam and fluid testing to identify the exact cause, ensuring you receive the correct treatment rather than wasting time on ineffective home remedies. Summary of best practices to support your natural vaginal health. Stick to the basics. Wash the external vulva with warm water or a very gentle, unscented cleanser. Wear breathable cotton underwear and avoid inserting products into the vagina. Conclusion: while a mild scent is a normal part of biology, a sudden or persistent change in odor is a signal from your body. Rather than attempting to mask the scent with fragrances, seek professional guidance to address the underlying cause.